Thank you so much.
I think it's very important to realize that taking care of your body is a form of self-care. If we don't put time into saving our body for the future, like she said, for the glue of our family, we're not going to be able to really, really, truly understand who we are as human beings, right? If you're waking up in the morning and you're already feeling tired, if you're not sleeping those 7 to 8 recommended hours, which is hard because I struggle, um, but if you're not pouring into yourself and not seeing that a doctor's visit is as good as pouring into yourself, then you're not going to be able to really function as the human you were created to be. It's very, very important that if it's cost is a barrier for you to know the resources, like she said, FQHCs. I am a product of a teaching health center. Teaching health centers are residencies that are based in FQHCs. FQHCs are federally qualified health centers. So I am a product of a health center down the street, Lawndale Christian Family Medicine Residency Program. And I learned how to also incorporate faith in medicine. And that's something that I find is always a barrier in our offices, right? God gonna take care of it. I'm like, yeah, God made this medicine too. So we gonna figure it out together, right? But it's being able to see how to take care of yourself and really, really pour into the person you are and using the resources to do so.
Thank you, Dr. O.
And I'd like to add to what the ladies have said here today that we can also kind of reframe it a little bit as well and take some of that burden off of the patient because those are true barriers that we've just listed and talked about. And it does make it difficult for women to try to seek care. And if we think about it, a system will adapt to change when it has to. If you think about coming out of COVID, we increased telehealth visits. There were more flexible care models. I was even a part of some mobile services that were going to unrepresented or underserved communities. So I would challenge the system to change and adapt to times that allows for more accessible and realistic healthcare for our country, our women.
Yes. Oh. Oh, okay. They have energy efficiency, but we are still live, ladies and gentlemen.
If I may add to that, she just
Please.
brought up a great point about access and telehealth. If you know, like the recent bills that were just voted on, one of the things that are at risk is telehealth because COVID expended, or what we gonna call them, COVID, the extra money from COVID is going away. Sorry, medicine is my thing, not politics, but we have to know about it because if you don't vote for the right people, if you don't look for what they, what they stand for, those are things that are at risk. And a lot of our people come through telehealth, right? They don't have the luxury of just coming in every day. So really, really looking into those different things as well in order to help your own health.
Yes, absolutely. And I absolutely agree with you all because that affects that time and access. Because what about those people who are working at jobs that don't have time off? And it's really hard to get off of work. And then now, you take all this time off and then, you're waiting for hours. And so things like telehealth is definitely bridging the gap and, certainly another way to be able to be more proactive rather than reactive. And so now, with also looking at still reframing prevention, another consideration is this, and this is also to all of the panelists. What myths or misinformation still exists around women's bodies, pain, and health advocacy?
Me again. Well, I think when it comes to pain, a lot of times women are not believed. Also, that it's normal, right, to have painful periods or aches and pains. It's just part of being a woman. Give me the other two. Y'all have to forgive me. My mind
this is also related to women's bodies when it comes to myths and misinformation, and also health advocacy.
And the health advocacy part, a lot of times women don't feel like they have, I don't know if the word I want to use is the right to say to the provider, I hear what you're saying, but this is my experience. And so it is a challenge, you know.
Um, I will say bring all your concerns to the doctor with you. I am very, very okay with my patients pulling out their phone and showing me everything on TikTok they done watched for the last 24 hours because I know that's where most of the misinformation starts. So I'm like, oh, where you hear that from? And they're like, oh, you want me? I said, show me, because we're gonna break this down together, right? We're gonna look through it because I have to be willing to meet my patient there. Because at the end of the day, we can talk all day and all night inside the room. Once they leave my office, they're living their life. They're going to go back to whatever they saw. And those thoughts in the back of their head are going to still ruminate and still tell them, well, should you do what your doctor said? And also finding a doctor that you connect with. It's very, very hard. But if you don't find a doctor that you connect with, you're gonna have this mistrust just building in you. And it's gonna affect every doctor you then see from that point onward. Like you're not gonna feel like you're heard. And if you want, I always say mind and medicine connect. Placebos work, and there's a reason placebos work because your mind is telling your body that it's working, right? So if you don't believe in what you're doing, then what's the point? So I always say, tell me everything. Tell me if we only got 15 minutes right now, and the clock is going, but I will see you in 2 weeks. If it's that much, I got to put effort, I got to put. So find a doctor that you connect with and bring the misinformation to them so that they can break it down with you.
Yes, I completely agree with everything that's been said already. I think we know historically women their symptoms have been dismissed. They end up internalizing. They pass this feeling down from generation to generation. I think what's important to know that things that are common, it does not mean normal. You need to have a safe space where you can freely express your concerns because we know that like delay in diagnosing care, it only creates more chronic problems, more complex treatment that is needed, and things that could potentially be avoided.
Yes. And, and especially from a gynecology, women's health standpoint, there's a lot of myths that are on TikTok and Dr. Google that have to consistently just be dispelled, and that part is right when we talk about medical mistrust, because it's not just in the women's health space, but it's in the family practice space as well. And even when we're looking more holistically with our bodies and everything that we're looking at, if we don't trust the provider that we're seeing, we're not going to follow what they're sharing with us. And so thank you all for answering that one. Now, when we're looking at physical health and prevention, another thing that we want to consider is looking at things from an equity lens. So that's really important too, because it's not just about it being available, but it's, the way in which it's available. And so I wanted to ask, actually, who has the mic? Okay, so Dr. Wilson, so I'm glad you have the mic because you were one of the folks I wanted to ask this one. So how does the healthcare system fail women, particularly women of color, when it comes to diagnosis, pain management, or preventative screenings?
I would say, I think there are two big things. I think it's dismissal and delay. I see a lot of patients, a lot of women, they come in, sometimes already very frustrated before we even start the encounter because I'm their third or fourth doctor they're seeing, and they've just been dismissed the entire time. I think that it is important, again, to create this space where we take the time to evaluate and to listen and to understand the patients, to help and try to help whatever kind of symptoms that they are dealing with.
Absolutely. Yes. Thank you so much. And, and the thing is, what you're talking about is really great, but I do want to make sure that we move on to, I'll have you as well, Dr. O, to answer that question. But yes, with gynecology, but I also want to hear from a family practice perspective as well for the audience.
Repeat the question one more time.
Yes. So we were talking about when it comes to diagnosis, pain management, or preventative screenings, how the healthcare system fails women, especially women of color.
I think it's not getting the information out to people that look like us, especially when let's take into account this month is Colon Cancer Awareness Month. There's this thing, especially among my Black men that come in. It's just like, you gonna put something in my butt? And I'm like, oh my, like what? what have you been told about this, or what have you seen about this? And that also goes back to just the misinformation part, but most specifically when it deals with, let's go back to pain management. Like, are you being told the different modalities of pain management you are offered, right? Are they only giving you opioids, right? Or are they telling you about NSAIDs and, breaking down the issues around NSAIDs and different ways to use NSAIDs? Like, what are we really breaking it down to what the medication does and not just prescribing based on what the person or who the person is? We have to be able to really, really give the information, let the patient understand the information, and then be able for them to teach us back what they understand. And then we decide together, shared decision making. That's what we've all learned in medical school, right? Let's go ahead and put that skill to work. And being able to trust, once again, that doctor-patient relationship, just to trust it. So once again, I'll say advocate for yourself, but then also be fed with the information. If you're not getting that information, know the different things of pain management. Like if you're in the labor room, you got the little gas, the laughing gas. You got the epidural. You got the one that make you really, really sleepy. There's all sorts of pain meds. But have you been told the options, or did they just jump to an epidural? What did they do, right? Just being able to know the options and then advocate for yourself in that op.
Yes. Yeah, you can go. Did you have anything to add to any of the, with? Okay. Yes, and actually, I did want to actually turf back to Dr. Wilson about because she mentioned some of the things. Are you able to have those conversations about pain management especially when it comes to either things like labor and preparing for birth, and then also things like menstrual pain, since we're, also from Women's Health Gynecology?
Yeah, so specifically as it relates to obstetrics, I make it a point prior to my patients presenting into labor, asking them have they even given a thought to what their pain management will be. Because for those who've had children, labor can be a very stressful time, and trying to make decisions then is probably not the best time for you. So it also gives us the opportunity to walk through, epidural, nitrous oxide, IV medicine, what that looks like, what that means, potential effects, potential risk related to the use of that. And I think that allows patients to come in more informed about their decisions. So when they do present, they kind of already have a plan of what they want to do. And the same as it relates to menstrual pains and things that we do from that nature. It's not just opioids. There are a ton of different medications. Right now, there may be some mistrust as it relates to like hormone use a lot of times. So trying to really explain that, no, I'm not trying to just give you birth control to give you birth control, but this is exactly what this hormone is doing and why it may be beneficial to you. And also respecting and understanding when people have used different modalities that, if they've had a bad experience, that was a bad experience, even if they were in the 1% to 2% for that to happen, it happened to them. I have to respect that and, keep that in mind. So.
Yes, absolutely. Yes, thank you for answering that additional question for me. And then, another thing when it comes to looking at things from an equity lens is, we talked a little bit about it, but answering more about what does self-advocacy in healthcare look like when power dynamics are uneven? I would like all of you all to answer that if you don't mind.
I think that's a very true, real thing that happens. I think it can be intimidating to come into a medical office and then try to advocate for yourself. I think it is important on the provider end to try to create a safe space, a welcoming space, so a patient can be comfortable, because the advocacy, it should be partnership. Even though it's self-advocacy, as important as that is, you should understand that patient has questions, allow again for open space to have the discussion without it feeling, judgmental or rushed or things of that nature.
Thank you.
List it out. All them thoughts that you had, write it on a piece of paper, come to the visit. I have patients that do this. Just write it all out. We'll do it one by one. You get me? We'll get there. But making sure that you have your thoughts together before the visit. Because if you come to the visit and then you try to list it off your head, you're gonna forget something. And then you're gonna my chart me or call me, and then you can't get me in 2 days, and then we're back to square one. And then that once again, that mistrust starts to rebuild. So list it out, write your thoughts out, bring those videos, come with your evidence so that I can meet you and really inform you on what those things are that are going to be beneficial to you. If you're not sure that your history is correct, go through it, right? Hey, doc, my records are stuck somewhere. We'll figure out how to get it. But always making sure that you're prepared. You don't want to seem unprepared, because if you're unprepared, then it's up to me to come up with the agenda of the day. And I'm just going to make sure that all your preventative screenings are done, right? And then make sure your blood pressure is stable. But imagine doing all of that and you still feel lost when you leave the visit. So making sure that you know what you want to do.
That's good.
And I'll just add to that. That's what I always tell people: go in prepared, write it down. Because if you think that you got it in your head, you will get there. They'll do their 1, 2, 3, and then you get in the car and you say, "Dang, I meant to ask him about X, Y, and Z," and so now you have to wait, or like she said, now messaging them through the portal and mad because they didn't get back to you, in a timely fashion. And another thing that I like to tell family, friends, and even my patients is that if you go in prepared, you feel like you have a serious concern and you don't feel like you're being heard, just ask them to document that they don't want to, investigate X, Y, and Z.
Mm-hmm.
And when they do that, they usually end up getting that test or lab or what have you. So that's just a little trick that I've taught people.
Okay. Yeah, that's a good one, y'all. I don't think I've heard of that one yet. I would be nervous if a patient asked me to do that. I tell you. And I will say yes, like she said, whatever that is, have them write that down if that's not the case. Bring your notes on your digital device, bring it written down on a piece of paper. And if you need to, my chart, of course, or whatever patient portal your provider office has. And then other than that, there's always telehealth, which we all brought up as well as another way to have self-advocacy. And if that's okay, I'm gonna just throw in one more thing as the moderator. Maybe even consider bringing like a family member, friend, or something like that. We bring in doulas when it comes to pregnancy, but it's just like, what about having a support person for just these other things that we're having issues with because we don't feel like we're being heard? And so it's just like, sometimes we need to have my patients they have somebody on the phone all the time. And I said, and who is that you have with you today on the phone? Because we, just like we need to know who's in the room with you in person, we need to know who's on the phone. So if you have to have a support person on the phone, FaceTime, or just listening, I would even encourage that as well. All right. So now, for this physical health and prevention panel, we want to move on to looking at things related to consequences of neglect. That's really, really important. So the next question I did want to ask all the panelists was, what happens when women delay care for themselves because they are prioritizing work, children, or elders?
Well, small things can become big things. And I have a family member who a small thing became a big thing, and she's no longer here because of all the things that you said, prioritizing family, work, being outside, or what have you. And so if you can go to your healthcare provider when it's small, when you first notice it, there's a greater chance, through testing that it can be caught early, if, whatever it is, before it becomes a big complex thing, advanced disease, disability, or unfortunately death, like in my cousin's case. And so, again, going back to question number one, if you are the glue, what is going to happen if the glue no longer has the stick? And as a family member, I see what happens when that glue no longer sticks. Everybody else is there to try to pick the pieces up and put them back together. So that's what I want everyone to do. And I'm always preaching about it, and my family gets sick of hearing about it, but it really is the truth. The small things can lead to big things.
Thank you.
You'll prevent the guilt later on, because it's the guilt that'll take you out. right? You not taking care of yourselves now, or not explaining those things now can build up to those big things later on, right? Simple things. Constipation. I don't know how many people struggle with constipation. And I'm just like, we can solve that now before it becomes a hemorrhoid, before it becomes constipation. Sometimes early signs of constipation can sometimes be linked to that colonoscopy you never want to take, to that that colon cancer that's just chilling in your gut because we didn't discover it early. You know, tumors can grow out and block the way of stool. Yeah. That's just why we always advocate, get a colonoscopy, please. But that's why we advocate for those things. So those little things, imagine you having hard stool can lead to the discovery of something else big down this lane. So always take care of yourself now so that you don't deal with the guilt of letting your family down, right? Letting those who you love down, because they'll come back and ask, well, why didn't you tell us early? Because I was taking care of this. You're like, oh, I could have taken care of that for you. And you're like, wait, I have the help, but that's only if I had asked, right? So it will prevent the guilt, but you have to step up for yourself and realize that those small things really, really matter.
I would even challenge us, to change our mindset, because I would say that sometimes we don't even think about this as delaying care. We think we're just doing what we need to do. This is our responsibility to wear a Superwoman, Superman cape and to take care of kids, family, prioritize work because we have so much going on. So we don't even think of it as not taking care of ourselves. We're taking care of our responsibilities. But to the point, small things can become big things. I've, seen a number of women who come in with, various bleeding irregularities, just think it's normal, think it's stress causing changes in their cycles. And lo and behold, now we have abnormal cells in your uterus that are now uterus cancer, and had we talked about this 6 months ago, we could have, fixed this completely. But that is what I would challenge us to do, to change that mindset that we have, and, and say that we are delaying our care. This is not, we have responsibilities, but we have to take care of ourselves first. It's like the airplane analogy. Your oxygen mask goes on first before you can take care of somebody else. So.
Yes, yes. So you all know to put your mask on first. You don't want to be guilty later because you are the glue. You understand? And I will also throw in there, even for my own personal self, because I practice what I preach. I think from my head on down to my feet, and I schedule everything on now. So what's coming next is my eye doctor's appointment, but I make sure that I schedule my own women's wellness visit, my own PCP visit, my eye doctor, my dentist, everybody at the beginning of the year before it gets real crazy. Because we know May comes around and it's Mother's Day and graduation and prom and all of these things. We got the summer vacations, and next thing you know, we taking the kids to go to get their physicals and stuff and shots for school in August, and we still haven't gone to take care of ourselves. So start the beginning of the year thinking of yourself. Please get your women's wellness visits. If you haven't had one, ask me about it after this, okay? But I just want to make sure to throw out and advocate that, because pap smears are not being done every year, and I'm seeing things on a regular basis where, because people haven't been to gynecology in many years, and these are things that are related to precancers and cancers that could have been saved earlier. Now, in the other consequences of neglect, I want to ask specifically, I wanted to ask Dr. O if we can, and Tanisha, and then we can get back around to you as well, Dr. Wilson. I wanted to ask about chronic stress and how it intersects with physical health outcomes.
We all know about stress hormones, right? Cortisol, all these things, right? Stress, I think we just think as stress as something we can deal with. And it goes back to changing your mindset. We all believe we superwoman. And I was raised by a superwoman, but I've seen superwoman also not become superwoman no more because of the stress, right? We all think we could take care of everyone else. And those things cause high blood pressure, right? Those things cause stress on your blood vessels that turn into high blood pressure. And somebody will just tell me, oh, it's just stress. And I'm like, I still got to treat the high blood pressure because y'all stress environment is not changing. You're going to go home to the same exact stress and think, okay, I'll just I'll just deal with it tomorrow. No, it's not going to happen. But if you take that before and understand that chronic stress does affect your body, you can handle these things. Chronic stress makes you want to eat, right? You'll go and instead of making food, you say, oh, I'm too tired. I'm gonna go to Chick-fil-A. You eat Chick-fil-A every day, you're not going to, some things gonna happen. That blood sugar not gonna look normal, you know? So there's just things we gotta start considering. Stress. We're drinking coffee, but I just had my coffee. That's bad. You know, I'm drinking coffee at 3 p.m. You think I'm going to be able to sleep at 8 p.m. when I want to tonight? No, but I'm just being honest with myself. I am not superwoman every day, every night, every minute. I cannot be there like that. So I have to take the time to take care of myself because chronic stress will turn into disease, chronic disease later on.
Yeah.
In my practice, being more on the functional kind of integrative approach, I talk about stress and how it impacts inflammation throughout the body, specifically in the gut. And when your gut is imbalanced, then it becomes systematic. You know, you have trouble losing weight, sleep, just all the things that women, you know, usually think that are just issues that because I'm a woman of a certain age. And so, like Dr. O said, stress may be the starting point, but it'll manifest in all these other aspects in your body, like high blood pressure, GI issues, sleep disturbance, not, you know, insomnia, just a number of things. So being able to manage stress, because you can't get around it, it's going to be here, but doing things to help manage it so that it doesn't have that kind of detrimental impact on our bodies.
Yes, thank you so much. And Dr. Wilson, did you have anything to add from an OB/GYN standpoint at all?
I would agree with everything they said. I think it is across the board from a multi-system that stress affects the body, you know, completely. I think you cannot hide from it. Your body will keep score. You know, it will sit you down when you need to be sat down. So just be mindful of that. So.
Yes, absolutely. Yes, it will. So please don't get to that point, ladies. And if there's any gentlemen in the room, please don't let your body sit you down for you because it's real. Now, we want to look now at a call to action in all of this. And so, Dr. Wilson, I wanted to ask you if you could talk more on this specifically, and then the other panelists, if you want to weigh in as well. What practical steps can women take to better advocate for their health without placing the burden completely, entirely on themselves?
I think we've touched a little bit on it earlier with some of the discussion, the questions. I find this to be an interesting time in medicine with, you know, social media and all the information that is available. It's not as hidden anymore. Patients do come in, you know, with questions. They want answers. It's no longer as simple as, you know, take this prescription and, or, you know, do this and that. But I guess they try to keep it simple first, kind of know your baseline. Know what's normal for you. So when things do feel a little bit differently, you are prepared to go and see your provider. We've talked about it, you know, coming to the visit prepared. So have your questions written down. Just like these ladies, I get the same thing. I just saw you yesterday, but I forgot to ask, you know, XYZ, and it takes me 3 days to get back to XYZ, you know, and, you know, then it also leads to some frustration sometimes because, you know, I'll say, hey, well, I'd like you to come in for a visit. Only because I don't want this to be rushed over a phone. This needs more than a 30-second, you know, telephone conversation and, you know, trying to, you know, get through with that. But I would say those are the biggest things for in terms of advocacy and such and trying to make that easier.
Yes, absolutely. And then I wanted to actually, if we could actually come back to you, Dr. O, because you brought something up earlier about shared decision making and just how this relates to the advocacy too. If you could kind of weigh in on that too for us.
Really shared decision making back to that question.
Yes.
Okay.
Yes.
Okay. Yeah. Once again, that list is very important, but then at the same time, like when you're going in and you're trying to figure out, okay, doctor said I should use this medication, right? Don't be afraid to ask what the medication does, right? Because that is where the misinformation is, right? Because I have people be like, oh, Dr. O, ibuprofen hurt my stomach. I'm like, okay, I gotta work this down a little bit more, right? There's certain things you do with ibuprofen that you're not gonna do with this medication. This is how you take it. This is when you should take it, right? Like if you're having periods that are very painful, you can start ibuprofen 2 days before. You can do this, you can do that. And this is why it works. It helps with inflammation. It helps with this, it helps with that. Being open to asking those questions and then allowing the doctor too. Like there's something I always do. If you don't want to take the medication, I say, go home, try it 4 weeks, you're away. Come back and see me in 4 weeks. We're going to talk about where you at, where I'm still at. Did you make the progress? Did you not make the progress? Okay, let's see what's next. Let's see which one you're open to. You go home, do all the research you want, bring back all your questions. Now we're going to find the actual research. I'll go and look on that's what we're going to spend this next 10 minutes looking through this research together, seeing if, African Americans are listed in this research, because that's another thing. That's something that I'm hoping to do in my future. God bless that. I can start in the investigation side, right? Because a lot of this research that they have outside don't include Black people, don't include minorities, color. It doesn't include us. But then these are the medications we're taking, right? That doesn't make any sense. And this is the research I'm supposed to use to prove to my patient to take the medication, right? There's that gap. So not only, just make sure you're advocating for yourself, coming with your questions, allowing the doctor, hey, doctor, can you if they don't give you that, I'll say, doctor, can you give me some time? Let me go home, think about it. I'll come and see you back in two weeks, 4 weeks. And they'd be like, oh, okay, that's a great option, right? Even if they don't give you that option, creating that space, advocating that option for yourself can also be beneficial, because then that gives them in that mind that you're actually trying. Right. And then if you show up, they'd be like, oh, okay, no, this patient really wants to do something better for themselves. Let me see how I can really come out of my skin to help them. Right. Because then they have a reason to pour into you.
Yes. Thank you so much for answering that. Yeah, because I actually was going to ask you to answer. So thank you. Come on in here.
Repeat the question, because I want to make sure what I'm about to say is
Absolutely,
appropriate.
but we know what's on your heart. So what practical steps can women take to better advocate for their health without placing the burden entirely on themselves?
On themselves, right. So what I was thinking is that as providers, believe them the first time. Believe the patient the first time. And I'm speaking from experience with one of my providers, where it took 3 visits before what I was concerned about would be addressed. And it was bias there, so even as a provider myself. So believe them the first time, it's something that we as providers can do to take the burden off of the patient. And so I always think about, if I didn't have the knowledge that I have, what about all the women who are sitting there who don't have the education that I have to keep coming back and telling them, can you put that in my chart that, you're refusing to do X, Y, and Z, or don't recommend to do X, Y, and Z today. So as providers, we can take some of that burden off of them by believing them the first time.
That's something we owe a round of applause to that one right there. I mean, we really do. We really, really do. There's just been so much medical mistrust. Women have been ignored in research. People of color have been ignored in research. And, how can, we as women advocate for ourselves when the system isn't advocating for us? So, that's really a challenge. But when we have providers of care that can listen to them the first time, do that. But look, if they don't listen, it's always called a second opinion, okay? We just got to keep going because we only get one body. So let's make sure to take good care of it. Now, this is actually my last question. So I know I've kind of sped through things, so I hope that's okay. And so this is lastly, let's still looking at a call to action. So what responsibility do employers, healthcare providers, and policymakers have in closing gaps in women's physical health?
How did I end up with this mic with that question? So employers obviously offering their employees how do I want to say this? Maybe a variety of insurance plans, or be willing to pick the one that will cover more, especially like specialty care and things of that nature. So employers can do a better job. Some employers are doing like wellness. I don't know what to call it, but
The programs.
yeah, wellness programs where they're sometimes incentivizing employees to get them to incorporate more healthier habits, change some lifestyle aspects. So those are things that employers can do. Employers, policymakers,
And providers.
and providers. Well, I think I just said what I had to say about providers, but policymakers obviously is continue to let people have their rights, specifically women. And thank God we live in Illinois. That's just my personal opinion. Stop taking women's rights away when it comes to healthcare. That's what policymakers could do to help all women.
Thank you.
Funding for schooling. It's hard to get into medical school now. It's very hard. I am the product of a Caribbean medical school. I did not go to a US medical school. It took me 2 tries. I was young. I graduated college with 4 degrees and a 3.98, and I still didn't get into medical school. And I did research at NIH and Johns Hopkins.
My God.
So imagine me not getting to medical school after 2 tries. I said, oh, for real? I took my behind to the Caribbeans. Oh, I went through a lot in the Caribbeans, but I am the product of a Caribbean medical school, and I'm proud to say it anywhere. But funding is going away. There's a lot of students now that can't use US funding overseas anymore. I used US fundings. Now imagine if that opportunity goes. Number one, a lot of Black medical students are actually in the Caribbean because they can't get into medical school here, right? And then when we get out, we got a whole bunch of people asking, well, you went to the Caribbean? I said, we learned the same thing. I don't know what you talk about, right? But it's the funding. The funding is the fundamental issue because if we don't have the funds, I didn't have parents who have thousands and thousands of dollars to send me to school. Right? I didn't have parents who were doctors. I didn't have parents with the inside man, but I had to fight for my medical education to get where I am today. And I'm completely grateful for that. But then making space for that is going to be very important. So advocating for those politicians who will actually stand up for us in Congress and in the Senate to be able to pass bills that will allow us to go to medical school, that will allow us to train in teaching health centers. I was a part of the advocacy group that went about my second year in residency. We went up to Capitol Hill to advocate for teaching health centers. Imagine teaching health centers are based in underserved areas. So I went to a teaching house, so it gave me an opportunity to treat people that like me, people who were struggling, people who were really in situations where they needed the help. And it's great to be able to be in that space because then they start with trust just because they see someone that looks like them. So imagine taking that away. So it's very, very important to advocate for funding so that people like us can get through the pipeline.
Wow, that's good.
I would also add, in addition to the funding, the actual, the number of spaces to train. So if you did not know, even if you get through medical school, depending on what specialty, there are not enough residency spots for the students in medical school.
Yeah.
So you could graduate and be in mid 6-figure debt, as most people are, because as we talked about, med school is expensive. Most of us, people of color, do not have, you know, trust funds. That's all loans. So it's awful. It's the funding needs to be there. The increased spaces to train needs to be there. They have projected a physician shortage for years, and trying to combat that. So I would challenge, my policymakers and politicians to look at that and really take that seriously. As it relates to employers, we've talked about different insurance plans and things, but also the flexibility. I mean, we're human. Like, we shouldn't be penalized all the time if we want to get away, for a doctor's appointment, and be able to get that time off and, come back to work and not be penalized for it. Or there are conditions where people need intermittent leave, to not penalize a woman because she needs 2 days off a month because her cycles are awful and she hasn't quite figured out, what she wants to do about it, or hasn't figured out to get the support because she's going to have this major surgery to treat this, and to allow that to occur.
Wow, that's good. That intermittent leave piece, specifically, I don't know how many people have heard about that. A lot of people think of, things like FMLA for just like, if they're sick themselves, but, or maybe like mostly if they have a baby. I think a lot of people associate FMLA, but like she mentioned, menstrual periods is certainly one that we see a lot. Some people have migraines, as well on a regular basis. There's lots of things that we can use, but if we don't know to use them, how can we advocate for ourselves or get these things taken care of to take care of ourselves? And you all are absolutely right when it comes to the policies and policymakers, and really even those that vote for those policymakers as well, because we can be more vocal, and talk to them when they're coming up with these things that affect us, because women are the largest consumers when it comes to, well, just anything, and but even more so healthcare. So when it comes to women's health, if you don't have enough doctors there, then you don't have enough, the women don't have somebody to care for them, and now you're waiting 4 and 6 months to see somebody. So how can you take care of your health that way? And so yes, it's absolutely true. And of course, if we don't have enough PTO on top of that, like you mentioned, we don't have leave and all of these different things, it's really, really hard. And so this was all of the questions for today's panel for Women in Leadership series by One Family Illinois. Did we have some audience members today that had some questions or some comments that they wanted to follow up on anything that we talked about today?
I've been on TikTok ordering everything that I've been seeing. And I'll take it one time and I'm like, okay, it's not doing nothing, but I know I got to take it more. And I ordered so is there a different, like I was taking the D3, but then they say you got to put the K2 with it. So so here I am like, okay, I was taking a D3. It was great. It was giving me a little bit of more energy and whatever it needs to do for me. But then I see the doctor saying, oh, we doing it wrong. As women of color, you're supposed to be taking it with the K2. So I ordered it and I take it a little bit, but not like I should. And then another thing, but I've been ordering everything. I can look at my list because
She done pulled her list out.
TikTok. So my best friend been like, well, what you doing, Patty? I said, well, I've been ordering all this different stuff from TikTok. Let me send you what I'm ordering. But another thing I want to ask about, like, okay, so my doctor, I went, and so she was asking, I'm taking some blood pressure medicine, 37 milligrams or something. So then she was like, oh, your cholesterol is up. So she gave me cholesterol pill. And I was one of the ones pushed back on it because I took it the one time and I didn't like the way it made me feel. I was telling my mommy, I don't like the way I feel the next day with it, right? So then I think by me not working out, I'm eating junk food a lot with my little kiddos. So I just happened to start taking it last week. I broke it in half, and I don't know, should I be doing that? But I feel better. I can feel a difference with it. And one more thing I want to ask you about. I've been taking the fiber. You was like saying about being constipated, so I'll be taking fiber tablets, and it does help. but should I be eating more vegetables and I'm drinking water?
So we'll start with the vitamins on TikTok. The number one thing I say about vitamins is that, well, this will also go back to your medication thing. Vitamins are also supplements, are also FDA approved, are also medications. All right. So you can take a vitamin, you can take a medication. All right. They also have side effects, right? You need to know what type of effect this is having on your body. So always go back. If you have a list of vitamins, go back to your doctor with the list of vitamins. If you're not sure, go on CDC or NIH, which NIH is a little better right now. So go to verified. That's the number one thing. Verified sources of information and see what these different vitamins actually do on your body. Because everybody and their mama think they are a doctor on TikTok and got no credentials and be like, oh, this person used this. This is what this worked for. Your genetics is different from your genetics. It's different from your genetics. It's different. What something does for you is different from me. And then about the medication and it not making you feel some kind of way. With every medication, as I've learned, my more prestigious, longer in the business people right here can tell you, there's other versions of the same medication. So that statin, maybe a different statin, that can do the same effect, can work with you and not feel the same. But you have to advocate for yourself and not give up, right? So if you take the medication and you give up after a day, you only gave me 12 hours of efficacy. We're not going to go nowhere with 12 hours, right? But if you tried every day, now I don't know about breaking pills, but that's for you and your provider to talk about. But, like making sure that, hey, doc, I have this situation with this pill. Is there another medication in the same class that can work for me? And these are my side effects. Can you help me make sure my labs don't look like the side effects is, going that way? Or what can I do to help alleviate the side effects if I decide to stay on the medication? Oh, get it all from your food. I hear taking chlorophyll and stuff like that. Just eat the greens, Eat the greens, eat the broccoli, there's a chart. If you go and look online, there's charts of high fiber food. Avocados are great. They hold a lot of fiber, broccoli, all your greens. You can find a chart. There's a number, I can't remember right now. There's a certain number of fiber you're supposed to get in a day, a number of grams. So try and meet that limit. I am Nigerian. I love rice, but I've stopped myself now, right? So if I'm gonna have rice and stew, there gotta be a bowl of broccoli. And my husband laughed all the time at me, but I'm like, I gotta put the fiber somewhere. Like I can't be having constipation because I know it's gonna hurt me later on. So finding things, add beans to your rice, right? Try to change your rice. If you're a Nigerian like me and you're eating stew, well, change the rice to brown rice so that you still have the flavor with the stew, but at least the rice is healthier. You find different things and different ways to kind of make it more healthy.
Can I give one other add on for the constipation? Make sure you're drinking enough water. At least 64 ounces. Most people feel like, oh, I drink enough water. And when they actually start to track, they're not even hitting 24 ounces, right? Because that's just how they see it, that they was drinking water all day. Increase your water and start walking. Even if you just do 10 minutes after like heavy meals, even if you walk in place by a walking pad, you'll be surprised how that'll help get things moving. And then make sure that you're not taking too many of those fiber supplements because that could bulk you up. It could do that like the opposite. Yeah. Well, Mounjaro is for people with type 2 diabetes. So what you would be looking for is Zepbound. But one thing, top four side effects with GLP-1s: constipation, nausea, vomiting, diarrhea. So get that constipation, get your bowels in order before you go get you some Zepbound.
I have a question. It's kind of around something that Patricia talked about. Can you guys speak about or share with us the difference between when you're taking supplements or when you're taking medication, the difference between a generic and a name brand? And I'll use the example of Caltrate, calcium. Some medication I was taking that weakens the bones. I was advised by my physician to take a calcium supplement, and I was advised by a friend of mine to take the Caltrate and not the generic version. They have the exact same amount of medication in it or whatever it does for your body, but the Caltrate, she said, was easier on your stomach. So with that being shared with me, it makes me leery whenever I'm prescribed a generic version of medication. Do you have any thoughts around this?
It's going to be which one your insurance approves. Sometimes I can't get out of that. And, I'm learning the scales of that because sometimes I'll send, Ozempic, and they'd be like, please change to blah, 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 blah. And I'm like, oh, okay. And we have brand name is like, okay, they came out with it first and they have the patent and all of that. And then after some months or years, whatever, then they release the patent for everybody else to jump on the wagon. That's how the generic comes out. So then the generic then is just, they don't have the patent no more. So now since everybody's making it, everybody got to cut their costs in half for everybody to start affording it again, right? So that's where we get the brand name to the generic, right? And then, like I said, it's your insurance that I'm going to fight that battle without, because PPOs and HMOs and Medicaid versus straight Medicaid, all of them want they have contracts and formularies with pharmaceutical companies as well. So that's how the healthcare system works. Everybody got to pay back in the pack. So it's based on what your insurance does, one, and there's not much difference. It's because the patent is almost the same. It's just a little bit of some molecules on the bottom that's different, and it does the same action. But those little molecules can make a difference, because that's why I said one medication can work great for you, and one medication can not work, and then I got to switch to another generic, find another brand, or find another medication in the same class that works for you.
In regards to supplements, they're not always created equal. So you do want to check. So it's not, Tylenol, acetaminophen is pretty much going to be what it is, right? But like when it comes to supplements, you do want to check that back label, because they might have some fillers in there, and that could be the difference between why you took a generic calcium, supplement and felt away, and your friend, took a brand name supplement. But it's not so much the brand name. It could be that the brand name doesn't have those added fillers.
And I just wanted to add, just from working in community health, additionally, for those who just really, really, really want to pay out of pocket, there's always the GoodRx as an example, as well as Single Care. Those are little cards that you might see at your doctor's office, or otherwise it's an app. You can even go to that website and you can put in the name of the medication that your provider prescribed, the milligrams, how many pills, and how often, and all of that, and it'll tell you the prices of all of the different pharmacies nearby you, and you can pick the pharmacy that you want based on that price, and then they can change it and send it to that location. So if that's really your jam, let us know, and then we can send it to the right one that you need. Okay. Did you have a question?
Oh, I got the mic.
Oh, sorry. My apologies. I think you might be next.
I just had a question as someone who's diagnosed with multiple different things and sees multiple different doctors. How unorthodox or possible is it to, I saw this on Grey's Anatomy, ask your doctors to have a staffing to talk about the different medications that you're on, because some of these conditions are newer. So I'm on certain medications that I feel like are counteracting other ones or making things feel a little different. So one day I was like, I think all my doctors need to just get in a room and figure this out because I can't figure it out. And ChatGPT and me, we go together real bad. But I was wondering, like, is that a thing? Like, have you seen that before? What does that look like?
I always say the family medicine, internal medicine, primary care world, we're the mediators. I say to all my patients, you go see all your specialists, go see all of them. Come back to me in 3 months, and we're gonna go through all their lists together. We're gonna compile it, right? We're gonna go through all the medications. If it take me 2 visits, it just took me 2 visits. I'll see you this week, I'll see you next week. But we can go through it, and then your primary care is your mediator of the whole, is the one that is the joint meeting that you're asking for. Because one person, the specialties sometimes don't have time to look through everything or look through past notes, especially if like gyne and ortho, two different, it ain't gonna work, right? But we can sometimes create that time like, hey, doctor, I'm only coming for medication management today. Can you look at all the people I've visited in the last 3 months? Tell me what's going on, and then kind of compile everything, sit me through it, and then I can make the decision. Okay, this is, next time you go see this person, this is the question you write, you ask them. And if, the wonderful world of EMRs, right? Most of our notes you can go back and see. So like sometimes I'll just note it in my note that this is the question that they have, so that if the other doctor opens my notes, they can see that these are the questions they have over this medication, and they'll go over it, be like, oh, I forgot that question, but it's on my doctor's note. Don't you got Epic? Can you go look at it real quick? Mm-hmm.
I think I've seen it, I've participated in it. I think sometimes it's a little easier if your care is in one medical system. I think as I speak like to the primary docs, I'll get EMR messages like, hey, I'm seeing such and such today. She said she talked to you about this. What do you think about this? So they do become the mediator for some of that. Like it'll be a group chat with myself and 5 other specialists on this kind of chain of like, what do we think we're doing about XYZ? I know Dr. X, you just started this. Dr. Wilson, how do you feel about, stopping this for now? So that does happen. Like I said, I think it's a little easier in a system where all your physicians are in that system. But I would ask, maybe just ask your primary, does she mind reaching out to those specialists for you to see if she can, he or she can get information for you to help kind of navigate that.
I have a question before I hand it over to Ms. Tier. We were joking about GLP-1s, but I have a question. Because a lot of us are getting our information on social media. And I'm gonna just say it, I saw it on TikTok, where people are microdosing GLP-1. So they're taking it for a short amount of time to lose a little weight, then get back into the exercise routine. And like, I'm sitting there like, that sounds like a great idea, because then it helps you get to where you need to go, and then you can do the rest of the working out. Now, a lot of the doctors are not prescribing it, but now there's the generic Hims and Hers and those other, and so like, just real practical advice about 1, where we should be getting our medical advice. 2, if there is, other than the side effects that we know about GLP-1s, if there are things that we really should be watching out for, and is the microdosing a bad idea?
I don't prescribe them, but my understanding of it, I think Dr. Lee may be able to speak to a little bit better. With the microdosing, like you can lose the weight, but once you stop, if you haven't changed things, that weight's coming right back, So yeah, like it comes back is what my understanding. And then also with like the online pharmacies, the Hims and Hers, some months, maybe even a year now, there was some controversy because those are the way they make them. They're not the same as like the tirzepatide or Zepbound or the Wegovy. So they're a little bit different. And also those multi-vals weren't as effective as well as just the regular prescription for Zepbound, Wegovy, or Ozempic, whichever one that people were on. So some of the primaries I talked to are like, be leery like some of those online pharmacies because they just may not work as well with that. So
everybody try to make a buck. Microdosing is just breaking it up into smaller pieces. And a lot of the online pharmacies use compounded medications. So they're not the original forms of either the generic or the brand name. So just imagine them broken down and broken down some more. Yes, they are still the medication, but they're not at the full rate of efficacy as the ones that are prescribed. Some are, not all online pharmacies do it that way, but you have to be cautious about where you're going. Even these weight loss clinics outside, ask them, what you giving me? Like, can you give me the name? Take it back to your primary care, right? Just making sure you have that true information, which is why it's very important. Even if you see a million specialists, go and find a primary care doctor. Please. I feel like that's the number one thing that we don't get enough of in our Black and brown communities. Like, a primary care doctor is essential to your future. Literally, they will track everything and you can see the same person for like 15, 30 years, you know? It's just creating that. And then you grow the relationship where, like, we don't even need to go through everything every annual. We know what we're talking about today, right? So growing that bond. But then there was another, you said microdosing. Oh, okay. Taking it for a little bit. I always say GLP-1s are a bridge. They're a bridge to your better self. Because at one point, just like you don't want to take your blood pressure medication every day of your life, you're not going to want to take your GLP-1 every week of your life, right? So they are a bridge to help you get to your better self. So while you're losing the weight on the GLP-1, you want to be in the gym. This is your time to find out how the gym works. There's Nike training apps, Nike training workouts. It's all free. And you can do it at home. They ding it on your watch. They walk you through it. There's so many different ways of working out at home. I got a little step box. If I can't make it to the gym, it's me and my step box and African dance beat in the morning. You know, finding ways to start to incorporate that while on your GLP-1. And then after, when you stop it, you have the way to then lose the weight. Because the thing is that once you stop it, that weight is coming back. And then also on GLP-1s, there's a plateau phase. There will be a point where you don't lose any weight on it, right? You'll lose, and then you'll do this, right? And then it's like the slope changes, right? So you have to be very mindful of that as well.
It's my turn. I'm joking. First of all, very quick question, but want to say thank you, Delphine, for putting this together because I am newly employed here. Newly employed. I'm newly employed, and I have not been to a doctor since September 4th, 2024. I have my first primary, I'm dating doctors. My first appointment is on Monday. And so when you talked, when all of you spoke, but I'm the queen of writing notes now. And so I have my future physician's appointment. I have all of my notes. Like, I was listening to you intently and taking notes as you were talking. And so just thank you, because now I'm excited because I have so much to say, and now I know what to say back when they say, oh, can I see this? Or, oh, I don't know about that. My question though, are you all taking new patients? You are? Do you have business cards with you? Okay, thank you.
Yes, yes, yes.
I have a question.
I just got to advocate again. Your well woman exam. Please see your gynecology provider. You should be having 2 wellness visits a year, one in family medicine and one in gynecology, please. I typically tell everybody in gynecology, we take care of everything that fits in a bikini. Okay, so we check your breast, we do your pelvic exam, your pap smear. Your family medicine provider may do that too. They may or may not. So just in case they don't, and they check you otherwise head to toe, everything else is checked out, because we always forget one or the other. And best believe when patients come to see me, I say, do you have a PCP? You got to see somebody, because Nurse Flowers don't take care of stuff with your toes, okay? Or you got to see somebody else. But yes, I'm just advocating that again. 2 wellness visits a year, ladies. Okay, just wanted to throw that out there. Thank you. She do it all.
Good evening, everybody. This has been great so far. And I just wanted to tie it all together because You had questions about self-advocacy, you had questions about body image, you had questions about related to fear of judgment when we go to see the doctor. You just brought up the issue of GLP-1s and everything. So I had to put my question and write it down. When we think about the social pressures of looking a certain way, of acting a certain way, especially us in the Black communities, when we don't fit the BMI standards, how do you, as providers, educate about and address concerns that we as patients have about weight bias in medicine?
Well, in my practice, I actually created a framework because I do have men too, so I shouldn't just say men, but I want everybody, specifically women, to not get caught up in what people look like on TikTok and Instagram and things of that nature. But what foundational pieces can you put in so that you can reach your optimal health, right? So I might get some pushback about this. I feel like if we can get your BMI to 27, even though that's technically still considered overweight, but if you have those healthy habits in place, you're good. So the goal with me and my patients, if that's part of why they come to see me, is weight loss, is not to get you to 25 and below, right? So with my framework, it's called Reset. It's designed to help you get better 1% every day, right? Working towards your best self. Who do you want to be? So I think once, at least for my patients and even myself, once you wrap your mind around that I am working to improve my health, and in that building of those habits, the weight loss will come. It still all comes, into one big circle, that it's not about perfection. It's about progress and how you're trying to reach your optimal wellness, especially at a certain age. Sometimes you have to accept you're not going to be that 20-year-old, version of yourself, but how can I be the best 51-year-old self I can be in regards to health, how I see myself in the mirror, my mindset, all the things.
The word obesity scares people. And I can't get away from that. That's the only thing I can code sometimes when I need to code for things that I'm going to get you eligible for. But I use my time in the office to say, look, I'm not worried about the numbers of the BMI most of the time. My issue is, what does your cholesterol look like? What does your liver look like? Because there's this silent thing called metabolic associated steatosis of the liver, right? Hepatitis, and your fat can do some things to your liver, and people don't know about that. That's actually what one of the indications for GLP-1s now, but people don't know about that. So I'm not looking at your figure, and I'll tell them straight up, look, I got to put this in your record, but that's not my goal. What do you eat? Let's start there. Do you work out? If you say you are too busy to work out, okay, you got the Step app on your phone. 10,000 steps a day, ma'am, please, or 7,000 to 8,000. That is the proven one where you can at least gain some type of cardiovascular, it helps your cardiovascular system, at least if you're walking 7. And I'll tell them, look at my app. I'm not doing well. We can both work on it, right? So it's making sure that word obesity doesn't scare people away. It's a diagnosis. It's not the person. It's what I use to code. I'm not labeling you. I'm only trying to find a better way to you as a person. What are your health goals? Let's set them up. If it's taking 15-minute walk after eating every day, start integrating it into your schedule. Taking the steps instead of, going on the elevator. Park at the end of the grocery lot instead of parking near the door. Making those small differences, because all those, I'm reading Atomic Habits. So all those little all those little, you should read that book, please. It's a great book. So all those micro differences start to have an exponential change to your body, to your mindset. And that's what's going to get your weight down, if that's a goal of yours. But if not, that's not a goal. I'm not going to be mad at you if you come back and say, as long as your cholesterol don't look like that, and you don't have arthritis, from weights, or you don't have these things that are complications of weight, I'm fine with that. But once again, I got a code. That's how it works.
I agree with everything that was said. I also think that, we all realize like our society has changed. Like this diet, I tell everybody every day they're trying to kill us. I just last summer recently started growing a garden, and I had my own tomato, and the fact that tasted very different than the store, I was like, oh my God, like this is amazing, but also frightening at the same time. So the same thing, I promote just optimal health and optimal wellness. So whatever that looks like for you. If all those numbers are in line, they should be fantastic. Are you active? Are you, moving? Fantastic. Are you trying your best to do what you can to balance your diet? Fantastic. That's how I look at that.
Being in women's health, although I only take care of what fits in the bikini, some kind of way, the question still comes up about what can I do about my weight? And I say, do you have an Alexa remote? And they said, yeah. I said, do you have a private space where you could just like a little open piece of floor, in that same area in front of the TV? Yeah. I said, well, you're going to turn on YouTube. That's free. And they got all the things that you can find on there. Shine Fitness is one of them. So people who really love to dance, they make up dance routines to some of the most popular songs and things like 3 minutes. They got 3-minute ones. They got 30 minutes one. And if you're a person that love to dance and get you some good music, do something like that. Yoga. I've been doing yoga on the TV for years at home, 15 minutes, but it's really worth to be able to, if you don't have the time, you don't have the money, and everything, that's where we say something like meeting patients where they are. Well, let that meet you where you are. So I just wanted to throw that in there as well for you all.
So my question has to do more so with genetics and the things that we go through. So I've had numerous surgeries since I was 16. At 16, I was told that I couldn't have kids because my ovaries were just covered in cysts. I had surgeries to get them removed. At 22, I had my son. Again, at 34, I had my daughter, but when I had my daughter, I had my tubes tied. They grew back. I got pregnant again, Unfortunately, I had dysplasia. And because I did have cervical cancer before, and I had a cervical scraping. So when they finally decided, let's do a pregnancy test, they found out that I was pregnant, but my body was unable to hold the child. So I would have been on bed rest. At that time, my daughter was already 4 months old. So I decided to get an abortion, right? Took the pill, went back for the follow-up. The doctor heard a heartbeat, so that didn't even work. So then they had to, take the fetus out. Just 2 years ago, I had another surgery because I had an isthmuscele, which is a hole in my uterus. I'm textbook. Now I'm in medical journals because they could not find my case anywhere in any medical journal, My daughter now, she just went through her second cycle. She's 10 years old over the weekend. And she bled through her pads. She had to change her underwear 3 times. Now I am scared that she's going to go through the same things that I've been through. She's only 10 years old though, and I want to take her to the doctor, but I feel like going to the gynecologist for the first time is super traumatic, especially for a 10-year-old. So what can I as a mother do to prevent or to make sure that I have an early handle on this so that she doesn't go through what I've been through in the past? Because again, I've had numerous surgeries since I was 16 years old. And I just don't know what to do now with my daughter.
Did you want to answer that first? Okay.
I hope not. Like firstly, I would, hope that she has like a great pediatrician. And it sounds like your gynae history has been very complex. What I would suggest, because going to, I would say the regular gynecologist like myself can be a little bit traumatic. They have pediatric gynecologists. So they see young girls for disorders or symptoms that are out the norm, right? That you don't expect your 10-year-old to bleed like this. I would see a pediatric gynecologist for that.
You can also like have a conversation, try and have a conversation with the doctor before you take your daughter in, or like set up like, hey, like with the pediatric gynecologist, like, hey, can we have a telehealth visit? Like she'll be there, but then at one point I'm going to ask her to step out. I want to explain everything I've been through and my worries, because as the parent, your concern needs to be heard. And you want to feel like you're in a space where you're advocating for your child. So you having that trust with the doctor is going to be monumental to the care of your daughter. So making sure that your concerns are heard, like, hey, like you can still do whatever you need to do with my daughter, but I do need you to hear me out first. This is what I went through. This is my issues. How can we go about it? What is your game plan? And then you can bring the child into the situation so that a safe space is created for both you and your child.
And I for instance, like you mentioned, like there's an adolescent gynecology, I know for sure, like at University of Chicago Hospital, for instance. So they do have providers that specialize just in taking care of young people who have gynecology needs, but that are younger than what we may see in the traditional gynecology setting. And I absolutely agree too with maybe having that conversation with the provider first before bringing in your daughter. Healthcare in general and our worries and concerns and things like that. I don't know if anybody has pets, but it's almost like, if you're nervous and the dog is nervous and you're trying to go to the vet, they're not going to go in there with it. They're not going to go to see the vet. And, and it's just like that same energy can be passed on to your daughter. And what we don't want is, no matter if it's the adolescent gyne or if it's a traditional gynecologist, that your daughter is afraid of going to the gynecologist, and she's afraid of having her period. And now we've placed all of this possible undue fear on her. So I do agree with having that conversation first. Help her to also, together with you, maybe look at tracking her periods. And just since these things are happening, at least help her to just be more prepared. So just have those period packs. They actually have a lot of them now that they sell that are just for preteens, actually, that they have out there. But just always knowing to just be prepared, and to also like know where her school nurse is and things like that, so that she can feel a little bit more empowered, because there's always so much shame when it comes to menstrual periods and having flooding accidents and all these type of things. But if the school nurse knows, and she is prepared, that at least allows her to feel better. And then have her to write down her questions too and her concerns, so that way when you all go to see that adolescent gynecologist, she can also feel empowered too, and that she understands that this is the type of person that I need to see when it comes to my, female body parts and the things that happens with them.
So comment and a question. So my comment is, when we talked about, the panelist was describing call to action, describing what that could look like. And this relates back to the last question from Rebecca. As in our family, we had a lot of storytelling about how you grew up, who was grandma, who was auntie, what we went through, but we didn't talk about the health. My mother is no longer with us and had me at a late age in life, but didn't have those conversations with me around what happens after my menstrual cycle. What happens in that next phase when I'm starting to go through like the puberty and menopause? And now she's not around to answer those questions, so I have to ask my sisters. But my point in terms of mentioning that, in terms of call to action, we need to begin to have these conversations with our family. It should not be taboo. And not just the young ladies, but also our sons as well. They need to know the health conditions of our family so that they can be prepared and how to have their better selves. And they don't believe that it's just natural to go through whatever they're going through, and they go to the doctor and they're maybe denied or not listened to. So use this a part of storytelling and talking to your children. Make it a natural time to have a conversation about what it means to go through your menstrual cycle, what it means to be prepared to go through perimenopause and menopause, because now people are becoming more comfortable, but we're still not talking to our children. So that's my call to action to everybody that's here in this room. My question has to do with every year we hear through the medicine field that there is something about the gut. I've heard yesterday, I was telling colleagues about cholesterol. Now they're saying get cholesterol testing 9 through 11. What should we be listening for and preparing ourselves and families? What are the top female ills that are going on that we should be aware of? Or is there? How do we start?
I'll say, one of the things that I'm still concerned about a lot, and I have to advocate for patients to always think about is, as you mentioned, family history. There is something that's called hereditary breast and ovarian cancer syndrome, where that there's a possibility of if that family member had that cancer and they had that gene, that it could also be related to that other cancer. And a lot of people hear about or heard about BRCA1, BRCA2, sometimes call it BRCA1 or 2. I always advocate for patients to get a panel of genetic testing when you have a first or second degree relative that had one of the hereditary cancers. But it's not just breast and ovarian cancer. There's uterine cancer, which is very important. Colon cancer is really important. Pancreatic cancer. So there are some genetic cancers out there that a lot of people don't realize that, oh, my aunt had that, my grandmother had that, and they had no idea that that was something that could affect them, that they can get genetic testing for, that they can get more preventative care for, and testing and screening, and even do more, extremer measures. So if that's removing certain things, so be it. Some people will get mastectomies, for instance, just to, as the most preventative thing that they want to do for themselves, because they don't want to have to go through breast cancer. That's their choice. But if you don't have the testing, you can't have anything to, get coverage with insurance, because we know the insurance, world rules everything. And so, but it's really just about having that knowledge. Knowledge is power. So that'll be my one that I'll add, and I'll just have the panelists add on some others.
Well, regardless of what it is, I think testing and screening is your first start. Like many people may or may not know, like colorectal cancer, it was once suggested to do your first colonoscopy at 50. But they're seeing so many people get diagnosed advanced stage under 45, right? We just had, can't think of the actor's real name, but James Vanderbeek was under 45, Chadwick Boseman under 45. So just knowing when are screenings suggested, mammograms, colonoscopy and things of that nature. In regards to gut, there are tests out here that can take stool samples and get a real good picture of what's going on in your gut in regards to your microbiome. So if you feel like some of the things that you're experiencing are coming from your gut, that's a good way to start a GI map. That's usually not covered by insurance, so it would be an investment in yourself. And things of that nature. But knowing when screenings in regards to age, family history, as much as you can have, and then just the proper follow-up.
Advocating for you to know as much as you can about your family history. Though I know in cultures that's, especially for my culture, that ain't something we talk about, right? I recently spent a month in Nigeria working about a year ago. And this was during residency, and it's a taboo to talk about these things at the dinner table. It's just a taboo, but I realized that the taboo also was causing misinformation and people thinking somebody's grandmother that's chasing me. Ain't nobody grandmother chasing you. Like it's something we got to take care of. Knowing the preventative screenings, the ages of the preventative screening. If there's anything, look up. Hey, even I think ChatGPT can do a good job of this too. You know, I'm 45. What's all the things that I can do at 45 for preventative screening? Right? Go with that list. You know, make sure your doctor just doesn't say, oh, healthy eating and diet discussed. No, they did this, this, and this, and I need this, this, and this because I can get it from my insurance, right? But making sure not only now I'm equipped to have these conversations, and it's not like, oh, I found out this grandma died at, my accent's coming out. This grandma died at 40, you know, this grandma died when she was 60. Okay, well, what killed her? Don't nobody know. Well, all of a sudden, she, you know, she was sick and she passed away. Well, she died like that. Something must have happened, right? But then if you give your doctor that information, then I'm thinking in the back of my mind, okay, maybe I should look into something else, right? Maybe I should make sure they have this, this, and this screening. So being open to share the ages that your family members, especially your first degree family members, passed away. That's vital information, because if I'm hearing that a male in their 50s passed away, what am I thinking? Okay, maybe I got to look for prostate cancer. Maybe we start your prostate cancer screening at 50 instead of, you know, we just screen it. Just tell me if something wrong down there. You know, you're not peeing right, something like that, right? Those are things that are helpful.
From the lens of like an OB-GYN, I would say, I think fertility. I see, you know, a lot of women are starting families later in life, but I think that sometimes as women, we take our fertility for granted. You know, I'm not ready to have kids. I'm not worried about it, but now that I am, you know, now I'm running into a little bit of trouble. So I do talk to some of my younger patients who, you know, like, hey, are you thinking about kids? When are you thinking about kids? Is that at all on the radar of something you want to do? And even if it's something they say, yeah, maybe in 4 or 5 years, you know, I would recommend like, hey, you may want to just get an awareness checkup to make sure everything looks okay with ovarian quality and things of that nature, because that may change your timeline. Because those are things that don't give symptoms all the time. You know, you don't have something happen for you. So fertility is one of them. Menopause is now, and perimenopause is now a big buzz. And I see a lot of women coming in who were like, I thought I was just going crazy. And now that they're able and feel more comfortable. Yes, estrogen, all the things that comes with that, but feeling more comfortable discussing it and wanting relief, and now knowing that they don't have to suffer or just deal with the changes that are happening in this new phase of life. And then the breast cancer screening. I can't count how many women I see who are over the age of 40, sometimes who are younger, who need early screening, who do not get the appropriate and proper screening. We know that if diagnosed early, it is very treatable and very, you know, curable. 1 in 8 women will be diagnosed in their lifetime with breast cancer. That's without any elevated risk. You line up 8 women, 1 will have breast cancer in their life. You know, so early prevention is key with things. So the getting it yearly. So typically with like mammograms, we start with like low risk or average risk women to have their mammograms at 40 and do that yearly. I'll see women who have skipped 3 or 4 years, you know, in between that time. Getting into the family history, because I have some patients who should have screening earlier than that. See geneticists, as we kind of talked about with the panels, and just stay on top of those things. So.
I moved back to the state so with the health system, and you have been very, give me hope and motivational. So thank you very much.
And I just want to say thank you all too. Shingle, because my doctor was like, oh, you gotta take this shingle shot, and I didn't want that. And I took it, but I didn't take the other half. So do I need to go back and do it all over again? I be trying not, but I want to take care of self, because, like you said, a small thing can turn to something big.
I just had one question. Supplements, is it a such thing as too much?
Yeah. See them as medications. There's a such thing as overdosing your vitamins, right? There's things that can happen when you take too much vitamin K and when you take too much vitamin D, you know? Yeah, vitamin B. There's always the same way there's too little deficiency, there's too much, you know? So they can have effects. Like look at the back, especially the multivitamins. If you're taking a multivitamin and then you're also taking like 5 different other things, like look at the back because some of them might have duplicates and you are just times 3ing all the things that you probably shouldn't be taking too much of it. And if you're not sure how much to take per day, look, you can go on NIH, you can go on familydoctor.org. That is sponsored by AAF. I think AAFP, don't let me say something that's not right, but that is a verified resources. But yeah, you can look at how much of each one, your daily value. That's important to know so that you know that, hey, if I'm not getting in, because some of this you are getting in food. It's not like you're not getting anything in food as well. So be cautious of how much you're putting in your body. And the shingles, just I'm gonna say this: talk to your medical provider. But please, like your shingles shot. Okay, so they say everybody over the age of 50 should get 2 doses. All right, and that's because chickenpox virus is dormant in your nerve. So when you're stressed or there's some trigger, all of a sudden that virus takes its behind from the dormant area and this, trickles all the way back to your skin. And then you get that burning rash and the burning blisters. And it's not only to help of it not happening, it's also to help the duration because those things can last for a while, at least the lasting pain from it. So that's why I always advocate. What are your concerns about it? Is it just vaccines overall that you have a concern about, or is it because of this part of the vaccine, or somebody else took it and they was like they had a reaction? Well, what reaction did we can work through that? But plus, if you took the first dose and you felt good, you was okay. Take the second one.
So now we have the growth of the cannabis industry, right? So I want to get your opinion on using cannabis as like a pain reducer. So like I said, I've had a lot of surgeries. I've been prescribed almost every painkiller, every opioid. I hated them. I did not like the way I felt. I did not want to take them. When I had my last surgery, someone brought me over some RSO. I took the RSO for pain, and it took the pain away. I felt like I was able to go outside, go on a walk. I was able to wash dishes. I was able to do the things that I would do in my daily life, right? Things that I could not do when I was on the opioid. When I was on the opioid, I just felt bedridden. So I want to get your opinion on using cannabis as a pain reducer now that the industry is growing so rapidly.
Yeah, I was gonna ask, what is RSO?
I don't know what it was either, but it's like it's a brick Simpson.
I don't know what it is.
I didn't get it. Someone brought it to me, but they were like, "This is for."
Oh, okay. I don't know much about that industry. So, oh, yeah, I wouldn't be able to chatty over that much on that. Yeah. I don't.
Yeah. Mm. And as we would all say up here on this panel, I would suggest to go back to your primary care provider, your PCP. But there are providers who are that specialize in medical marijuana. So you would look at that, and there's actually cannabis nurses as well out there. So there are nurses that actually specialize in cannabis, medicine as well. So that's their vein. I actually know a cannabis nurse. I could send you her way, but otherwise, yep, see your PCP.
All right, what did you think? Let's give our panelists and our moderator a round of applause. Thank you. I've learned so much, ladies. I can say ladies, doctors and nurses, and I've learned so much today, and I appreciate it. I want to leave with our audience, as we've done over the last couple of weeks, the gems that I heard and I made note of. First, Fallon, I'm gonna say, take care of everything that's in that bikini. I like that, right? Guilt will take you out, right? What happens when the glue no longer sticks is a telltale sign for you. Advocate for yourself. Just like we advocate for our families, our friends, and everybody else, advocate for yourself. Change our mindset, because if we come into our provider's office with, no, I'm not going to do this. I heard this on TikTok, but you're not going to be able to hear what's possible. So change your mindset, ladies and gentlemen. Chronic stress will turn into chronic disease. Okay? Your body keeps score. I don't know how many of us have run. We've had that cape on. We said 2 weeks ago, we're no longer wearing our capes. Leave your cape somewhere else. We broke up with our capes. Don't wear them, because your body is going to keep scoring. When it goes down, you're down for a while. Okay? Know your baseline. And I know we didn't talk about this much, but I think the panels, your screenings, that's part of your baseline. So go to the doctors, ladies and gentlemen. Believe the patient the first time. So know that your body tells you what's happening. And so you have to use your voice to make sure that your physician or whoever your practitioner is hearing what you said. And they're not going to say it. If they're not listening, break up with them and go date somebody else. And the last thing I heard is, thank you, Tanisha. Put that in my chart. Okay, you don't agree with me? Put that in your chart. Those are gems that we don't naturally hear when we go to physicians, but we heard all of this information on tonight, and we need to use it. So if you haven't had your physician appointment this year, as of today, we'll give you 30 days because it might take you a while to get an appointment. But go see the doctor from head to toe. Go see the doctor. Here, One Family O, we have PTO time. You can go see the doctor, right? All right. So again, I want to say thank you to our panelists and our moderator. You ladies have done a great job. We appreciate you. Please join us next week for our third session on financial health. Right? None of us plan to work forever. So you want to do some of those things that make you happy. So join us next week for our financial wellness panelists. Next Wednesday, you can join us in person. You can join us virtually at 5:00. We join for a little networking and connection. And then 5:20, 5:30, we will start our session. So again, thank you so much and enjoy your evening. Thank you so much.
Thank you.